panelists. Dr. Mallika Marshall is a doctor at Mass General in Boston, and Dr. Jennifer Harstein is a child psychologist. So, Spencer, let me start with you. If you're in a situation like what happened in Boston, what are some basic things you should remember to do?
You want to remove yourself from that volatile situation. Run away as fast as you can. Get somewhere safe. Get help. And provide as much information about what you witnessed to the authorities as you possibly can.
And Mallika, if you want to be a citizen, a good citizen, and come to someone's aid, what should you do in terms of medical care?
So I think the first thing you want to do is reassure them that they're going to be okay, that you're here, that help is on their way. You want to, if there's have anything that's bleeding, you want to try to stop the bleeding by tying a tourniquet or applying pressure. If someone's unconscious, obviously you should begin CPR, so that we should all be CPR certified so we could provide that in case of need. And then if someone is in a dangerous situation, there's falling debris, you can move that person. If they're not in danger, then leave them.
Though,
exactly.
Right?
So only if it looks like they're in danger, otherwise leave them put because they might have a neck injury.
Meanwhile, Jennifer, a lot of people are writing to us asking us, how do I talk to my child about it on Twitter and Facebook? One has a 3, almost 4-year-old who said she wanted to put a Band-Aid on the people and stop the hurt. And why do bad things happen to good people, basically? What do you tell a child that age?
Well, it's such, their imaginations are so wonderful, and we can encourage their sense of giving and their sense of goodness. But we also have to remind them that bad people do exist, and it's a shame, and we don't like that they exist. And everybody is the police, the fire departments, the FBI are working to find the bad people and really reassure these young children that they're safe, that you as their parent are doing everything you can to keep them as safe as possible.
Another person wrote that she has a 6-year-old son who lives in the area of Boston, has seen too much, and she said she didn't have all the answers. Should you not let a child, I would imagine, that age watch television? It's hard, isn't it? Because you want to know what's going on. And is it okay if you don't have all the answers?
It is absolutely okay that you don't have all the answers. None of us have all the answers right now. We can't give clear answers, and I think it's okay to tell your children that and that you're working to find them out. Shut the TV off. Do other things. Get life back to normal. Go back to routines. Go back to the things they know. They will find safety and peace in that.
And finally, a gentleman named Tom tweeted, my 18-year-old daughter might go to Boston University or Boston College. She was crying along with her 15-year-old sister. And that did make me think about older kids, because I talked to my 17-year-old daughter, Carrie. I said, it is so awful, isn't it? But I didn't really let her express herself. I assumed that she was old enough to process this, but they aren't necessarily, are they?
Well, she is, and yet she still might need to talk to you about it. So similarly to little kids, say, how are you doing about this, Carrie? What do you think? Any thoughts about this? Let's talk about what this might mean to you.
All right, Jennifer, Mallika, and Spencer, thank you all so much.